Right, and here's yet another video, rudely interrupted by my camera as usual. This is on ICU and critical care bed usage. ICNARC is the Intensive Care National Audit and Research Centre, believe it or not. It's a bit of an acronym, and they publish every week the number of people who are still in intensive care. They tell you how many have died as well, and how many have been in there, and how many have recovered. If you want to read a bit of there's a bit of positive news and quite a lot of negative news really. My forecast curves that I've mentioned already, okay, this was the optimistic one, although they're similar at the moment because they're near the bottom of the curve, was giving these numbers, okay, for the day before these reports, which obviously if they're reporting on 4th of April, it's for the 3rd of April really. And this is what I was forecasting, 3,500 and 6,000 basically for 11th of April and 18th of April respectively, or rather for the 10th and the 17th, and this is for the 11th and the 18th, which is the actual reporting days, okay, and obviously the results for those aren't in yet. And I modified those forecasts a little bit because I got slightly lower curves and a slightly more optimistic forecast the last time I did it. And this is basically the sort of numbers I got. On the optimistic curve, 3,500 beds again, just under 5,500 beds for the 18th of April or the 17th, whichever. This is for the 17th. These are for the 18th, which is obviously a little bit higher. So you're looking at quite high figures at the bottom for 17th and 18th of April, and high figures for here as well. And of course that's above our original capacity, but it's not above our current capacity. Actually, it's about the same, 6,491, so that's just within our capacity. But of course, the beds are localised, and you have to remember that they're not going to be moving people up to some hospital up north from somewhere down south in an ambulance with a ventilator, I don't think, especially when they've got, you know, hundreds of people to move. They're not going to move them, are they? You're going to have to take your chances with your local healthcare, whatever you've got there. You're going to have to take your chances with it. Okay, the second half of this is, do lockdowns work? Well, maybe not. PM's speech was 23rd of March. Lockdown really, such that it is, started the 24th. There are still idiots out there sunbathing and walking about and spitting on the ground and all sorts of other stupid shit. But anyway, there you go. That's what you get in a country that where there are a lot of idiots, basically. Right, luckily there are some sensible people. How long did it take the lockdown to work in China? Well, about 13 days. Peak new cases 5th of Feb. South Korea, which is exceptional really, 8 days, because they did a lot of testing and they found their cases and they isolated them very, very quickly. Italy, which didn't, they took 13 to 20 days. Their peak sort of between those dates. They locked down really hard on the 9th of March. And I was looking for some sign 2 weeks later. Spain, I looked on 28th of March, not really quite there, but the peak has since happened, around about that date actually. France, I think France has already peaked now. Okay, the percentage change fell on the 3rd of April, so that started to take kind of 17 days. I had a couple of up and down days since then, but it might be just under 3 weeks. In the UK, 3 weeks is coming up actually. But that was 2 weeks on the 6th. It's now the 9th. So in sort of 2.5 weeks. Yeah, well, whatever. You know, I don't know. There were a couple of days where we got fewer cases, but the deaths are absolutely skyrocketing. So it's really, really difficult to say. I had a little look on this, and this is on my COVID-19 stats.blogspot.com about South Korea. And this is what the government said. 3 ways to prevent further infection. Wear a mask at all times. Wash your hands properly with soap for more than 30 seconds. And cover yourself when coughing. Another report said testing is central to the outbreak response because it leads to early detection. It minimises further spread. The vast majority ordered to quarantine are perfectly healthy and never do get sick, but the few who do develop symptoms can be quickly isolated further. And now they're doing the other sensible thing. They're stopping inward-bound cases. The new mandatory isolation for all arrivals will go into effect on 1st of April, the Prime Minister said at a government meeting. And there are the links. And I think actually, and they've got 9583 cases as of 29th of March, and we've got, 60,000 already. They've got about 10,000 cases now, actually, but, it's completely less than we have. Okay. So, yes, I was looking at Italy's lockdowns. The main one was on the 9th of March, but they really had done some starting on 21st of February of those really badly hit regions like Bergamo. And then northern Italy, including Milan, on the 8th of March, 16 million people, and then 60 million people on 9th of March. So because I was analysing their trend from the 24th of Feb, this was kind of already in place, okay? And the trend did get pretty bad after that, actually, because it wouldn't have stopped. There'd have been still some people getting infected, still some people turning up as cases very ill who got infected before 21st of Feb, probably up to a week or two later. And the same is true for the 9th of March trend, which is why you need to look for a change in the trend a little bit after that, 2 weeks after. So if you look at Italy's trend, for instance, you can see actually this was 2 weeks after on day 62. And then the trend takes a big dip down here. Okay, so that gave me my optimistic forecast for Italy, whereas this big curve covering about 40 days gives me my more pessimistic forecast for Italy, which are on my charts, which I've shown you many, many times before. And that's about all for today, folks. That's Spain. And this is Italy, and goodbye.